Thank you, Mr Deputy Speaker. I've had a few Stroud constituents in tears in recent weeks as they've been with loved ones in A&E and elderly residents stuck on trolleys. No MP wants to deal with that, and I know you're working hard, and I welcome the announcements, but the public are watching more and more money go into the NHS, and what I think we need to hear very clearly is what is your assessment, what is my right honourable friend's assessment of when the new announcements, the more money, is going to make meaningful change in Gloucestershire's A&E departments and elsewhere?
Well, I think it's a very fair challenge, and I would segment it into three sections. I think firstly, there is a recognition that the combination of the legacy from the pandemic, the ongoing COVID pressure, but particularly this massive spike in flu, creates an immediate pressure in our A&E. And the package today recognises that. It shows we have listened to the front line and responded to that. But secondly, there is a recognition, and it goes to some of the questions in the House today, that the system has been under pressure for some time. And therefore, the second phase is around looking at innovation, technology, the AI, the virtual wards, the ways of doing things differently that actually, particularly if I take the frail elderly, addresses their needs upstream in the care home before they get to the emergency department, or that releases them from hospital quicker, providing they have the safety net that they're part of a virtual ward where they're subject to ongoing clinical supervision, and that if they need to come back to hospital, they can do so much more easily than would otherwise be the case, and stopping that boomerang of patients released early and then coming back. That's the second phase, and that includes, for example, the modular capacity as well, because to streamline, to triage, they need space, and it is that compression within the emergency department that also drives inefficiency and poor care. But there's also a third part, and this government has invested in its life science industry. Our R&D investment of £15 to £20 billion is a big mark of that. And part of the prioritising is to say, actually, there are certain things we can do at scale with companies like Moderna, which will shift the dial in terms of healthcare. And that is a third but significant part, particularly around the prevention work that we can do.
Emma Hardy.